Hi everybody, we're doing a live right now. I'm just waiting for THIP Media.
Hey,
There it
hello.
is. Uh,
Finally.
yeah,
Hello,
it's a
Dr. Aditya. I'm so sorry for all of
no
this
problem.
mess. Uh, Technical things, kabhi bahut.
I understand.
So my voice is clear to you?
Yes, absolutely.
Great, great. So I had already introduced you to our people there of the live. So maybe I'll give a gist of the topic that we are going to discuss on, and then we can maybe start the questions, right?
Fair enough.
So great. Thank you, Social Potato. And so for all the people who were not there during my introduction of the topic, uh, this discussion is going to be about diabetes and its impact on eye health. So a lot of people around the world are struggling with diabetes, and a lot of them have undiagnosed diabetes as well. So कई बार आई हेल्थ का आई से रिलेटेड इश्यूज हो जाता है एंड पीपल डोंट नो व्हाई इट्स हैपनिंग और पीपल कांट रियलाइज कि ऐसा कुछ इशू हो रहा है सो बेसिकली वी आर गोइंग टू हैव दिस डिस्कशन टू अंडरस्टैंड कि इसके अराउंड का सब सिम्टम्स एंड व्हाटएवर राइट सो थैंक यू सो मच डॉक्टर फॉर बीइंग हियर shall we begin?
Yeah, absolutely.
Great.
Thank you for this
So what common
opportunity.
thank you. What common eye health problems may serve as our early indicators of diabetes?
All right. So Shabnam, what we normally see is with fluctuating blood sugars. मतलब blood sugar अगर ऊपर बढ़ता है हमारा, तो आई नंबर बहुत फ्रीक्वेंटली हमारा चेंज होता है. जो चश्मे का प्रिस्क्रिप्शन है वो सपोज जैसे हम देखते हैं डायबिटीज हैपेंस मोर विद ओल्डर एज ग्रुप. सो इन
Right.
दैट ओल्डर एज ग्रुप इफ देयर इज अ फ्रीक्वेंट चेंज ऑफ योर ग्लास नंबर, अगर आपका चश्मे का नंबर चेंज कर रहा है हो रहा है बार बार, सो इट कुड बी बिकॉज ऑफ फ्लक्चुएटिंग शुगर्स. So that itself is an indicator that there is an undiagnosed eye problem which is happening. The second most important, in fact, thing, the most important thing is diabetic retinopathy. In diabetic retinopathy क्या होता है, हमारे blood vessels जो होते हैं retina के, they start misbehaving, let me put it this way, and उसकी वजह से they are bleeding tendencies, and that can lead to vision loss. And this vision loss could be some dark spots in your vision, or it could be just blurred vision that you're seeing. And often this also is missed by patients, so it's very important to have a regular checkup कि अगर डायबिटिक हो तो once in a year अपना रेटिना और पूरी चेकअप ठीक से कराएं. That's important. The other things are cataract and glaucoma जो हो सकते हैं, and definitely something called dry eye syndrome.
Hmm.
डायबिटिक्स में ड्राइनेस ज़्यादा होती है बिकॉज उनके मीबोमियन ग्लैंड जो हमारे ऑयल बनाते हैं वो ब्लॉक जल्दी हो जाते हैं. सो दीज ब्लॉकेजेस कॉज अनस्टेबल टेयर्स एंड दैट कैन कॉज फर्दर exaggeration of eye problems. So in broad, this is what it is.
Okay. Um, so already you have talked about the symptoms and stuff in like usme. Are there any specific other symptoms that people who have like undiagnosed diabetes, who may not know that they have diabetes, should take as potential signs of basically having diabetes?
Yeah. So if the eye problems related symptoms, that's what we are looking at. So usme I would talk about blurred vision. If you suddenly develop a blurred vision, or you don't know cause for your visual disturbance, you know, sometimes they see colored halos अगर pressure बढ़ जाता है because of diabetes or any other reason, तो light में देखते ही splitting of light हो, or you need extra light to see things, that means there might be a diabetic cataract which is coming. So any visual disturbance which is unusual without a cause, so you have to rule out diabetes, because it's becoming more and more frequent, and at a younger age also, because of our lifestyle habits and our bad eating habits. Diabetes is actually getting detected much more and earlier.
Right.
So ऐसा नहीं है कि अब डायबिटीज बढ़ रहा है, ऐसा है कि हमारी लाइफस्टाइल इज going towards more modernization, and it's a modern day problem. Diabetes is actually a developed nation problem, let me put it that way. So that is
Right.
happening more and more in India.
Okay, so what role does, so generally tendency, जो लोग चश्मा पहनते हैं मेरे जैसे लोग, we have a thing कि हम regularly we go for eye checkups, right? But for other people, what role does routine eye examinations play in detecting diabetes specifically in its early stages?
So अगर आपने अच्छी तरह सुना होगा तो we were talking about different eye diseases which जो normally बिना diabetes के भी हम सुनाई देता है, जैसे dry eyes हो गया, है ना?
Right.
So a routine eye examination reveals a lot of things, and in that, diabetes could be a partner in causing a dry eye. It could be a partner in causing a cataract. Sorry, it could be a partner in glaucoma. It could be a partner in any retinal problem. और ये सब के सब तभी पता चलेंगे अगर हम रूटीन एग्जाम करें जो फ्रंट टू बैक हो. बेसिकली लॉट ऑफ रूटीन एग्जामिनेशंस डोंट इंक्लूड a gonioscopy, which is very important in finding out how your angles are doing and checking out on glaucoma. They do not include a retina examination or fundoscopy. So it's very important to check the as much as you can of the eye, because what we generally see on a slit lamp, जो सामने चिन लगा के देखते हैं, as you know,
Uh-huh.
you've been wearing glasses,
Yeah.
only 30% of the eye. So the rest 70% has to happen after a dilated check. And dilatation में time लगता है, हमारा vision gets blurry for the day, so we all avoid it as much as we can, which is not a good habit, because it's very important to pick up these subtle things early ताकि वो reversible हो जाए, rather than once it becomes irreversible and cause vision loss.
Right. Um, Before we continue further, I would like to tell our audience about our diabetes community on WhatsApp. So, people, if you're serious about diabetes management and eager to connect with like minded people, please join our supportive community of individuals like you. Simply drop a message in the chat saying I'm in, and we'll make sure that you get an invitation, or else you can go to the bio of THIP Media and check out the communities. So moving on, are there particular risk factors or demographics that should be especially vigilant about eye health concerns related to diabetes?
Yes. So again, the talk about lifestyle. So
Hmm.
people who have a very nomadic lifestyle, means they're eating out a lot, they're not exercising, they don't sleep well, they're more prone to having diabetes. So a lot of unhealthy, sugary, fatty food, obesity, all these are more prone to having more diabetes than somebody who's more fit. So yes, ऐसा नहीं है कि you don't see it in fit people, you can see it, but lifestyle has a major impact on diabetes, especially type 2 diabetes. So it's very important to you get your lifestyle right as early as possible. In fact, आपने सुना होगा, a lot of people who have been pre-diabetic or diabetic, and they exercise and they get their life back, and then suddenly they're not diabetic anymore. So that does
Hmm.
happen because of the fat being burned and the body metabolism coming back to normal. So yes, those people are more prone to having diabetes. So if you're one of them, you have to get your life back on track. So we know who we
Okay.
are, so that's what it is.
Right. I know who I am. I am all of those above.
Correct.
So,
We all are, especially
um,
doctors, because our lifestyle is very sedentary, so we are very prone to having high risk problems. So yes.
right. So, what are the potential consequences of delayed diagnosis of diabetes on the eyes and overall vision?
Yes. So a lot of the words or the diagnosis I spoke about, like glaucoma or diabetic retinopathy, often can be non-reversible. So if we detect it late, और हमें पता चलता है इसके बारे में after the damage is done, it's very difficult to get maximum vision out. So it's very important to stop the damage from happening rather than play fire rescuer and rescue you after you're burnt. So in the same scenario, अगर diabetes का असर इन पे बहुत ज़्यादा पड़ जाता है, the effective outcome of the vision and overall is much lesser as compared to if we get to know in the initial stages and we stop any damage from happening. Again, जो बोलते हैं prevention is better than cure. So yeah, that works
Right.
in all medicine here definitely. But whereas
So I
cataract जो
think,
होता है diabetic, let me just put some light
yeah,
on
sure,
that.
sure.
The cataract diabetic, definitely once we do a good cataract surgery, which is now more frequently seen because of good technology and skill available in India, uh, we do recover a lot of vision back. But again, these
Okay.
cases are more prone to retinal swellings post cataract surgery or a complicated cataract result. So in cases you have to be very selective about कौन सा lens डालोगे and how the vision is. Don't have to be too ambitious in trying to be glass free here, but you have to
Hmm.
be more ambitious in what suits the retina and the eye after a good examination. And most cases are now dealt beautifully because most of our centers in India are well equipped and good
Right.
skilled.
I'm so glad about that because eye health is actually very important. मतलब विजन के बिना लाइफ मैं थोड़ा बहुत इमेजिन कर पाती हूँ क्योंकि एक बार मैंने चश्मा हटाया फिर मुझे कुछ नहीं दिखता है तो फिर एंड इट्स वेरी टफ सो या are there any technological advancements or diagnostic tools that help in the early detection of diabetes through eye examinations?
Uh, Yes, technology has a big role to play with diabetes, not just the eye, but overall diabetes. Now we know we've heard of a lot of artificial intelligence or even your selfie camera. I'm sure all
Right.
of us have seen the Google launch, which happened a couple of years ago, where they had partnered with a few institutes, including an Indian institute, where they managed to take fundus photos, which is basically through the small pupil of your eye, the front camera of your mobile phone was able to take an image, and then that image was processed through an artificial intelligence which had machine learning, and they were able to pick out how normal that retina is, does it have any diabetic changes or not. So yes,
Okay.
I'm foreseeing a lot of technological change, and I'm hoping that it becomes more available like your phones are, and we are able to get better screening in the future. Of course, cataract and everything, the technology has already reached a level where we are able to bring great results even in diabetic patients and pick it up early. And a lot of machine learning is happening, a lot of AI is getting involved. So tracking your medications, tracking your sugars, a lot of these watches are able to pick up a lot of other things. There have been some patches now which regulate the medications which are required for diabetes. So it's getting there, it's getting better, and we are using technology in the right way. So yes, I'm
Yeah.
hopeful that it's going to be more influential in the future.
So I hope so too. So that's all that I had at my end. Maybe I can pick some questions if there are any questions in the from the audience. Uh, Person has asked, mm, tell me something about uh, varicocele. I don't know what it is. If you could, if you
Yeah, so
can
that's not
understand.
the. Yes, so we would take it to general surgeon.
Okay. So
You're getting a little
इसका
too
सवाल इसका
wrong side of the eye.
okay. Uh, what to do when your eyes feels, although this is not related to directly related to diabetes, but what to do when your eyes feels tears because of using mobile? Basically, आंखों से पानी आ रहा है बहुत ज्यादा मोबाइल देखने
Yeah,
की वजह से.
that's basically your own alarm system telling you कि mobile छोड़ दो. It's not a good idea. So basically, jokes apart, this is basically digital eye strain or dry eyes, which most of us are now facing. I wouldn't know two people who've not faced this in their life. Because what
Right.
happens is when you're staring at screens, we end up not blinking, uh, at least not blinking enough, and that causes more evaporative dry eye. Also, our
Okay.
lifestyle and the way we are and how we are around the air conditioning in the environment, that causes more of inflammation on the ocular surface, causing a worse dry eye outcome. So, a lot of treatment now is available, which is again a good thing. But again, that's something that you have to get yourself examined to find out which medicine or which lifestyle change would really help you. So yes, it's a dry eye condition.
Okay. So I hope that you got your answer, and we don't have any other questions. So I think we can conclude the
Great,
session.
great.
Thank you, Dr. Aditya, for joining today's session, and
Thank you for
despite all
having
the
me.
initial
Yeah, and
problems,
I'm sure a lot of
and I
people
would,
watch this will have questions, and if they do, please send them across. We can take them up
yes.
anytime.
Yes, so that's what I was going to tell them. Is that firstly, audience, thanks a lot for being here. We are dedicated to delivering expert health information from doctors like Dr. Aditya himself. And please stay clear of unreliable health advice on social media. Random information पे यकीन नहीं करना है. Follow the Healthy Indian Project on social media and WhatsApp for trusted health updates. आपका कोई भी सवाल रह गया है या बाद में आपको याद आता है, प्लीज डू शेयर ऑन आवर प्लेटफॉर्म और ऑन द व्हाट्सएप कम्युनिटीज. विल टेक इट अप एंड सेंड टू डॉक्टर आदित्य एंड गेट बैक टू यू विद द आंसर. Remember, when you know better, you live better.
Absolutely.
Thank you so much, Dr.
Thank you.
Aditya.
Thank
Good
you for
night.
this interview. Bye. See you.
Thank you.